Lifting and moving patients. So we're going to talk about protecting yourself, body mechanics, and emergent moves and non-urgent moves. So body mechanics. The proper use of your body to prevent injury and to facilitate lifting and moving. So before we do anything, we're going to consider the object, its weight, and whether it would require additional help to lift. Sometimes you've only got 2 people on a truck. Sometimes you've got more. Then you've got fire who can help lift as well. You want to know your limitations, and then communication. You want to make a plan and communicate to your partner what that plan is. Don't just go in and expect them to know what the plan is, or anybody else to know what the plan is. It might be clear, but you want to just make sure that they all have an idea of what that plan is. So rules for lifting. You want to position your feet properly, use your legs, and never turn or twist, and do not compensate when lifting with one hand. Keep the weight as close to your body as possible, and use a stair chair when carrying your patient on stairs whenever possible. Stair chairs are heavenly sent. They work really well for, obviously, stairs, and it depends on what kind of stair chair you also have. If you've got one with the tracks on, it's even better, just because then you don't have to go stair by stair. You can go straight down the stairs with that track. So this is a stair chair. This is one without the tracks. So if you had one with the tracks on it, you could lean your patient backwards and just roll them down the stairs, and it pretty much does it all for you. All you have to do is guide it. The power lift and power grip. So the power lift is knees bent, back straight, and you're going to lift with your legs, not your back. And then, as you see here in the second picture, the power grip is underhanded lifting. So when reaching, keep your back in a locked position. Avoid twisting. Avoid reaching more than 20 inches in front of the body. And avoid reaching when strenuous effort is required. Okay, so pushing or pulling. You want to push rather than pull whenever possible. Keep your back locked in. Keep line of pull through the center of the body, and keep the weight close to your body. If the weight is below your waist, push or pull up from that kneeling position. Avoid pushing or pulling overhead. Keep your elbows bent and arms close to your sides. Okay, so let's talk about some emergency, urgent, and non-urgent moves. So emergency moves. You're going to use these moves in situations where the scene is hazardous, care of life-threatening conditions requires repositioning, or you must reach other patients. Okay, so these are some emergency moves. The clothes drag, where you grab the shirt. You're not going to stand all the way up. What you're going to do is you're just going to scoot back while you're pulling on your patient, just like that. Okay, the incline drag, always head first, so that way you're not pushing your patient downstairs, you're pulling your patient down the stairs. Okay. Firefighter's drag, so you're going to place their hands in a tie and wrap them around your neck, and you're going to crawl out with them like that. Some of these moves we don't necessarily do or will do ever. So blanket drag, so you're going to basically put the patient on a blanket and then roll it up and drag them. Again, you're not going to stand up for this. You're going to crawl and move your patient that way. One rescuer assist. Okay, so you're going to just place their hand over their arm over your shoulder and neck, and basically just assist them. Okay, so two rescuer assist. This probably is the more often used move, even if we move like a patient from the floor to a bed or a couch or something like that. We use this. I don't necessarily put their hands over my head, or put their hands over my head, just because of the fact that I need to be able to get away. So what I'll do is I'll take my hand up underneath their armpit and just kind of hold them in their arm. So urgent moves. These are moves that can be used when you require treatment, and that treatment can only be performed if the patient is moved, and factors at the scene cause the patient to decline. So moving a patient onto a long spine board, it's used if immediate threat to life and suspicion of spinal injury. Patient is supine. We want to log roll onto their side and place the spine board next to the body, and then log roll onto the board. Lift onto the stretcher and then secure the stretcher to the ambulance. Okay, so those in your book, you'll have pictures and diagrams and various other things that will show you, as well as there'll be some videos in the online classroom. So rapid extrication, this is used for when taking time to immobilize the patient with a short backboard or vest before moving the patient may cause a deadly delay. So basically what we're saying is, if we have to, we can do a rapid extrication on a patient because something is going on. Normally, we would use a KED, Kendrick extrication device. Basically what it does is it's like a vest. It gets put on into the patient while they're sitting in the car, and then it makes it a little bit easier to move the patient out. Again, these are devices that we're not going to be transporting on. We're just going to put them on just for the time that we move them, and then take them off. So non-urgent moves. These are moves when the patient is stable, there's no immediate life threat, and the patient can be assessed, treated, and moved in a normal way. And we're going to take all required precautions to not aggravate existing conditions. Okay, so let's talk about some patient carrying devices. We have the stretcher, or any other device designed to carry the patient safely to the ambulance and or to the hospital. So we have a wheeled stretcher. There's power stretchers, manual stretchers, bariatric stretchers. Some of those are rated for 800 pounds or more. So the power stretchers are great. For the past 4 years, I've used a power stretcher along with a power load, and it's been absolutely wonderful. So for the time before that, we were using manual stretchers, and I have to say, by far my favorite manual stretcher is an H-frame. It's an old H-frame, actually. It's an aluminum H-frame type cot where when you push it in, the legs go in, instead of an X-frame where you have to lift the legs up. Somebody has to lift the legs up on an X-frame. This is that X frame that I was talking about. See, and this is actually a powered cot, but if this wasn't a powered cot, then you'd have to get down and lift these legs up here. Because it's a power cot, what they're going to do is they're going to push that cot into the ambulance and then push a button, and those legs are going to retract automatically. Okay, so this is another device. This is a different kind of power stretcher. These legs work independently of each other on this one. So when you place the cot inside the ambulance, this goes in, and then this will raise up, and then once you go, you could push it in a little bit further, and these legs will raise up as well. Okay, so this is a bariatric stretcher and setup, basically. So we've got ramps that go into the back of the truck. There is a winch that secures at the front of the truck up here, and they're going to basically winch this patient into the ambulance. On these patients, you want to keep the cot as low to the ground as possible to prevent tipping. So that's why we've got longer bars and handles on these. Stair chairs, they're useful where stretchers cannot be easily maneuvered. Again, where I am at, we've got lots of condos around the lake, and stair chairs are a wonderful thing. Spine boards, okay, they're short primarily for removing patients from the vehicles when neck or spinal injury is suspected. Again, we're not necessarily using these things anymore. It's recently new. There are still some services that do transport on the long boards. There's still some services that transport that use the KED to get their patients out. So it's a work in progress, but we're finding out that transporting those patients on a long board or backboard, or whatever you want to call it, is doing more harm than good for our patients. Okay, so this is that stair chair. This is a short spine board. This is a different type. So normally you'll see a KED. Our ambulances here have both. So we have a short board and a KED. The long spine boards. When you guys come to skills, we'll go through all of this. It's also on your NREMT sheets as of right now. It's something that I still need to teach you and how to do it. But this is just that. It's a patient carrying device. It is not a patient transport device. So this is a vest type extrication device, KED. This is that KED that I was talking about. Basically it goes around your waist and secures your head, and then it's got these handles that you can lift with. This is a scoop stretcher. We use these more now than we did before. What happens is these two halves come apart, and you place it up underneath your patient, and then you basically scoop them off the ground. With this, you have to make sure that you're not going to pinch anything. We do lift heavier patients. We do have heavier patients, so you're not going to necessarily, you want to make sure that you've gotten all the skin and everything out of the way, so that way you're not going to pinch it. This is a basket stretcher. We don't necessarily carry these on the ambulance. They more are for fire, for a rescue type situation. You've probably seen them on TV where they do rescues down a mountain, or up a mountain, or flying. These are those type of stretchers. Flexible stretcher. We don't necessarily carry these on the ambulance either. These are more for like mass casualty type trailers or situations. So a vacuum mattress. We don't carry vacuum mattresses anymore. We do have them. I do have them. You'll see them when we do skills. But we just don't carry them anymore. So again, you might see some services that have them. All right, so how do you choose the appropriate patient carrying device? So it depends on what's going on with your patient. It depends on various other things like how is your patient presenting? Are they awake? Are they alert? Can they sit up? And it also depends on what kind of terrain you're at. Are you in a condo? Are you down a hill, in a ditch? Various factors. How much help do you have to be able to get that patient out? So moving patient onto carrying devices. So patients with suspected spinal injury, we want to immobilize the head, neck, and spine before we move them. Perform that manual stabilization, place a rigid C-collar, and maintain manual stabilization until the patient is immobilized to the spine board. Again, there are lots of services out there getting on board with not backboarding their patients or not transporting their patients on a backboard. So we're not going to necessarily immobilize them to the backboard. We're not going to secure their head to the backboard or anything like that. So a patient with no suspected spinal injury, you can use an extremity lift. It's used to carry the patient to the stretcher or stair chair and can be used to lift the patient from the ground to the sitting position. So this is that extremity lift. So patient with no suspected spinal injury, we could use a direct ground lift, lifting from the ground to the stretcher. Okay, so doing this is, they've got to be, she looks pretty rigid there. So I doubt that that's going to be on a normal basis, but using this type of lift is fine. It's better to either use a backboard to lift that patient from there to there, or you could even use a blanket and place the blanket up underneath there and pick up your patient that way. So draw sheet method or direct carry method as well. Okay, so this is the draw sheet method. This is typically when you're moving from one patient from one bed to our cot. You'll use this quite frequently. So you'll just move your patients one bed to the other. And typically you'll have somebody over on the other side pushing while you're pulling, or lifting and pushing over while you're lifting and pulling over. So this is the patient recovery position. It's also called the left lateral recumbent position. So they're placed on their left side, hand on the ground. The arm on the ground closest to the ground is placed up underneath their head, and their arm is placed downwards. So shock positioning. Patients believed to be in shock in supine position. Do not lower the head and do not raise the legs. When you arrive at the hospital, you'll move the patient from the ambulance to the stretcher, to the hospital stretcher. and with a modified draw sheet method. Okay, again, this is where I was telling you, moving the patient from our bed to their bed. These two guys over here on the right are going to pull and lift, and these two guys over here, the EMTs, are going to lift and push. Okay, again, these videos will be in, because I cannot play them in the slideshow, in the presentation. These videos will be in your skill section of the online class. All right, so let's do some chapter review. The process of lifting and moving patients is a task that requires planning, proper equipment, and careful attention to body mechanics to prevent injury to your patient and to yourself. This is of utmost importance. I have seen many paramedics and EMTs have career-ending injuries because they did not lift properly. So if you want to stay in EMS for any length of time, you have to lift properly. You have to be clear on when you're lifting and how you're going to lift, what the plan is. You have to be clear about it, and you can't necessarily just go without it. Okay. So the most important rule in lifting is to lift with your legs, not your back. Keep your feet shoulder width apart, and keep your knees bent. Rules for lifting are for patients as well as equipment. Emergency moves are those that may aggravate spine injuries and therefore are reserved for life-threatening injuries. Urgent moves are used when the patient must be moved quickly, but there's time to provide quick temporary consideration toward preventing or aggravating that spinal injury. Non-urgent moves are normal ways of moving a patient to a stretcher after performing a complete on-scene assessment and completing any needed spinal immobilization and stabilization. Positioning the patient for transport should take into account the patient's comfort, medical needs, and safety. If I just have a regular patient, there's no spinal injury or anything like that, I let them figure out which is the easiest way to sit. In your COPD patients, they may want to sit with their legs dangled on the side of the cot and like straight up. So that's fine. They can do that. In your abdominal pain patients, they may want to sit curled up. That is a form of guarding. So when they're guarding, they feel comfortable. So let them do that. So remember the importance of correct lifting and moving techniques on every call. Protect your patient and protect yourself from injury to maintain a long and positive EMS experience. So things to remember: proper lifting technique is important. Biomechanics and rules of lifting help prevent injuries associated with lifting. Many different patient carrying devices exist. You want to choose the correct device based on a particular patient and needs of particular movement. Use the proper technique to move patients onto the patient carrying devices and position them for transport based on their condition. All right, so these are questions again that you will just see. I'll read them off. We're not going to go through them. I'm not going to go through them necessarily, but I want you guys to answer them based on what the book says, based on what we talked about today. So why are body mechanics so important when lifting and moving patients? Why is using the appropriate patient carrying device an important consideration? When would an emergency move be necessary? And in what ways can proper position help a patient's condition? Okay, so critical thinking. You arrive at a vehicle crash and find an elderly driver slumped over the wheel. Upon examination, you determine that the patient is in respiratory arrest. but not trapped in the vehicle. Which move would be appropriate for this patient? Okay. This patient requires an emergency move. The reason being is because they are in respiratory arrest. That is a life-threatening situation. So you do not have time to make sure that you preserve their spinal cord. Okay. So basically what I'm saying is life over limb. Okay. I would rather be alive and paralyzed than dead. Okay. So respiratory arrest is something that we have to fix right away. It requires that emergency move. All right. So if you have any questions, let me know. You can email me, text me, call me, anything like that. If you need something, let me know. And I'll see you in the next chapter.